We do know that 5 out of 6 children will experience an ear infection before their third birthday.
Yeah, isn't that crazy?
Wild.
Yeah, it's probably one of the most common reasons. I think it's if not the most common, one of the most three reasons why kids are brought to a pediatrician. But with that, it's such a rampant problem. But many times kids not only just have one, they oftentimes have multiple ones. If not, they just keep on going. There's oftentimes an underlying cause of that's just being overlooked. It's not because they are deficient in antibiotics. It's because there's something that's creating the environment to allow it to occur in the first place.
Okay. So with one usually leading to more, like, why exactly does that happen? Antibiotics don't work, so what else?
Well, the antibiotics, let's say they do work in certain situations, right? But they don't work to fix the problem. It's kind of like the fire department. They come in to put the fire out, but it doesn't fix the electrical problem that went on in the first place. So many times parents are told, or it's been kind of thought of, is that because with kids, their ear tubes are flatter, it's harder for them to drain. Whereas we grow, they become more angled and we help it drain more.
Okay.
But yeah, and theoretically, that's maybe a part of the reason, but it's not the cause. Because then why doesn't every kid have an ear infection? Right.
Yeah.
So I think one of the things that oftentimes is really being missed is because there's an underlying what is called a subluxation that's lying in there, and it's really the nervous system controls how the tubes drain. There's a muscle called the tensor veli palatini muscle that actually helps the tubes drain. It's kind of like if you drink water upside down, you can still get water to your stomach. It's not because of gravity. There's actual drainage process in the body, and that nerve that supplies that muscle is in the upper neck. And if there's something interfering with that nervous system that then interferes with the function and coordination of that ability to drain, then it creates a swamp.
Okay.
Right. And if things aren't, like, just think about a swamp, what grows in swamps, right? Yeah. and with that too, it's oftentimes too that creating that swamp, but you got to get rid of the swamp.
Okay, that makes sense. So my kid got an ear infection. They were on antibiotics, but they didn't work. Is there anything else I can do?
Well, number one, it's so often that the first thing is a quick response is to give an antibiotic, right?
Yeah.
But even the AMA says there should be a 7 to 10 day waiting period in the first place.
Oh, wow.
Because the majority of ear infections are actually viral. And the ear infection, like if the antibiotics don't work, well, it's because it's viral in the first place. Then what that does, using an antibiotic, it wipes out the good and the bad bacteria in the body, wipes out your gut flora, 80% of your immune system's in your gut. And now this starts to create a cyclical potential problem because now it's affecting not only not treating the ear infection, but it's creating an environment to allow them to occur more often now too. And that nervous system disturbance is occurring. So it really sets up an environment to allow for more of them to keep on happening.
I've heard a lot of parents talk about ear tubes. Yeah. What's your take on those?
Ear tubes, yeah, they work to help drain the ear, which can help with the symptom of an ear infection, but it doesn't correct the underlying problem of why it's happened in the first place. That's why even like with I don't know if you remember Camden recently, they came in and which happens many times too. They're already kind of went the route of pediatrician here, antibiotic after antibiotic after antibiotic wasn't working. They get referred to the ENT, which then says, we probably should use tubes, but then parent thinks about, well, can I do something else to not go that route and get surgery, but then have it, the surgery scheduled. They came in, same thing, he started daycare, started getting sick, right? Because like it's a crash course in the immune system building, right? Because they're around more, but with that, it only brings up the underlying problem that's occurring there already. Because when the body starts creating more fluid, it's harder for it to keep up if it can't drain well.
Right.
So he was going to daycare, getting ear infection after ear infection. Antibiotics didn't work. Was scheduled for the ear tube surgery. They came in. We got him scanned. We found that interference on the nervous system. We started working with it and started creating more common ease. And when they went in for that right before they were going to get the tubes, it was clear.